I'm Danny Russel. I'm Vice President of the Asia Society Policy Institute, speaking to you from beleaguered New York City. I'm joined by my friend and colleague, Wendy Cutler, the other Vice President of Asia Society Policy Institute, ASPI, known around the office as the Good Vice President. She's also Managing Director of our Washington office. Hi, Wendy. So, thanks to everybody for joining this webcast, and I sincerely hope that you and your family are safe and healthy. Today's the 7th in a series of ASPI web events looking at coronavirus, Asia, and the world. And I hope you'll check out our past programs on asiasociety.org/policy. And we hope you'll tune in for our next program next Tuesday, the 14th. With Kevin Rudd. As always, we want our live audience to participate in the discussion. So if you have any questions or great thoughts, please use the comment function on YouTube or Facebook. We're monitoring that, and we'll get to as many of your questions as we can. So today, Wendy and I are joined by a distinguished journalist, Motoko Rich, the New York Times bureau chief in Tokyo, who has been doing an insightful and in-depth series of reports on how Japan is responding to the COVID outbreak. Motoko has had a very impressive career in journalism. She's handled a really wide spectrum of human interests and issues before being assigned to Tokyo about 4 years ago. And she personally has a very deep firsthand experience of Japan that goes back many years before that as well. So for Wendy and for me, this is not only a great chance to learn from her, but also to turn the tables a little bit and for us to interview her for a change. So Motoko, warm welcome to you.
Thank you so much for having me.
Now, you've written very extensively about what to me is sort of the puzzle of Japan's low infection rate, its low fatality rate, and it's something that's hard to explain. Japan reported its first coronavirus case way back in January 16th, very early on, and it seemed like Japan was in line to follow China as the next big epicenter. Japan's only done very limited testing. It's kept most of its businesses open. It only just declared a shutdown, which is really a sort of sort of partial limited shutdown. And yet here we are 3 months later, and Japan has, a total of roughly 100 COVID-related deaths. Whereas New York, where I am, just in the last 24 hours has had 800 deaths. On the other hand, while the reported cases in Japan may be low in relative terms, the numbers are rising. That's something that your reporting has shown. And quite a few Japanese public health experts are afraid that the country's been living on borrowed time and doing too little too late to prevent the country from getting really badly hit. So can I just ask you to sort of paint a picture of where things stand in Japan now, and what's the situation and how to make sense of what seems like a paradox here?
Well, I think a puzzle is a really good way to describe it, and that's how I've been seeing it for a while, and just trying to figure out what exactly is going on here. And we're now at an inflection point. I mean, I think a few weeks ago I would have said it was a profound puzzle because Japan was not doing the things that other countries that seem to have successfully managed COVID-19 have done, which is test, which is even a recommendation of the World Health Organization. And so no one could figure out how it was that Japan was managing to sidestep kind of the chaos and disaster and tragedy that we're seeing, in New York, Italy, Spain, that we saw in Wuhan, in terms of hospitals being completely overburdened and, of course, these sort of tragic, unnecessary deaths. That, as you point out, doesn't seem to be happening here. But in the absence of testing, what I think we know is that we don't know a lot. We don't actually have an accurate count of infections here because testing is so low. I mean, it's an order of magnitude lower than places like South Korea, Germany, China, Hong Kong, almost anywhere in the world. It's like a very low order of testing here. So in terms of actual cases and infection rate, we just don't know. There is some worry that maybe we also don't even know how many deaths can be attributed to COVID-19. Pneumonia is one of the I think it's the fifth largest cause of death in Japan normally. So there's some speculation that maybe there are people who are dying that are just not of COVID, but are not being classified as such. But in a kind of broader picture, this is a place that feels like it's really trying to thread the needle. I mean, this is a situation that is both a public health crisis, but it's now what we're seeing around the world turning into a devastating economic crisis and a crisis of inequality, frankly, that both economies are being hammered as people are going into lockdown. And then the people that are being hammered the most are people who are least able to sustain kind of economic damage. So while those of us who are able to work from home and continue to do our jobs as we always do and get paid for it, are relatively unaffected compared to delivery people, restaurant owners, store owners, and obviously healthcare workers. And I think Japan's government is really, really concerned about the potential economic catastrophe that they're already experiencing. A lot of damage in terms of lowered tourism from, reduced visitors from China. They've closed their borders to 73 countries. So tourism has completely been wiped out, and that also affects consumer spending. So I think the government is really worried about the economic consequences. And so I have this sense that they're really trying to do both things, preserve the economy, but also protect public health. And the question that we are at this moment is looking around the world is that possible? And is Japan making the right choices at the moment? Like a lot of other countries have found that at their peril, that trying to protect the economy has turned into a public health disaster. And so right now, particularly in a place like Tokyo, which is a large, dense city like New York, as cases are starting to rise, albeit at what seems to be a relatively low level, like we had a record number of cases, 181. So I think some people look at that and say, well, yes, that's a record high, but it's only 181 cases. Deaths are still relatively low. Can we bob and weave and keep some places open, ask people not to go out, ask people to telework, and kind of dodge a bullet? And I just feel like we're at this moment where we don't know. And there's a lot of political fighting going over happening right now with regard to what course Japan should take.
Well, thanks, Motoko. I mean, that's insightful. One thing that we're noticing that there seems to be a struggle between the central government and the local governments with respect to how to define this emergency. What should be open? What should be shut? When, even when would the emergency be called, with Governor Koike wanting to take stricter measures earlier in Tokyo. So can you kind of, describe to us what's that dynamic about, what's happening? I noticed even today there were some discussions of which businesses are essential in Tokyo. Should barber shops be open or closed?
Right, right. I mean, I think perhaps you're seeing something similar going on in the United States, that there's a tension between the federal government and the state governments, and different states are making different decisions. And we're seeing something of similar play out here in Japan. About 2 weeks ago, Governor Koike was watching the Tokyo numbers start to rise. I mean, they had been really, really low. And then all of a sudden, this tells you something, that 2 weeks ago, 16 cases in Tokyo was a record high. And then all of a sudden they started just leaping up and up. And I think she got really alarmed and she started talking to the experts, some of whom are also advising the national government. And she really came out early and said, I'm not liking what I'm seeing. I'm really worried about it. I've been watching what's been happening internationally. Now is the time to sort of prevent a catastrophe. And so she went out and gave several news conferences where she said to the public in Tokyo, please stay inside over, I think it was 2 weekends ago. Please stay inside. Don't go out for anything other than essential business on the weekend. And so, but that was just a request. It was kind of, the power of the bully pulpit, if you will. There was no legal ramifications or even a legal request, if you will. And it seemed like there was a little bit of effect, but a lot of people were very concerned that that traffic just wasn't reducing all that much. It was also peak sakura cherry blossom season here, so a lot of people were still going out. And restaurants and bars and cafes remained open. So people were just going about their normal lives in a lot of ways. And so I think there was a lot of concern. Cases continued to rise. She asked again for the following weekend. And there was this sort of push and pull where everybody was freaking out and rushing to the grocery stores and buying, clearing off the shelves of meat and milk and bread and toilet paper, thinking that the government was about to call a state of emergency. And then it wasn't happening. And the prime minister would go and give a public press conference on a Saturday night, 2 weekends in a row, and say things like, we're on the verge of a verge, we're at risk of an explosion of infections. So I ask you, the people of Japan, to avoid certain circumstances. They kept emphasizing they call them 3 C's: closed, crowded spaces where you're often in conversation or singing. And they would talk about karaoke bars or live music clubs, because early on, when there had been some cluster outbreaks, they had been concentrated in those kind of environments. So to the extent that there was epidemiological data based on a very small data set, it seemed to point to those kind of situations as being particularly ripe for infection spread. And so they were asking people to avoid those contexts. But they weren't saying, but he would say, it is not to the extent that we need to call a state of emergency. So I think for a lot of people in the public, and I myself felt this personally with my own family, these were confusing and conflicting messages, right? On the one hand, we were sort of being told, they were using words like, we're on the brink, we're just barely hanging on, we're at risk of an explosion of infections. And then on the other hand, they were sort of saying, but it's not a state of emergency. You can go about sort of your normal life, just stay away from these particular contexts. So I think a lot of people were very confused about that. But I think that rhetorically, the governor was much more emphatic about it. And then when the state of emergency was called, legally, the government in Japan does not have the power, as some of the states in the United States that have called, ordered people to stay at home, or like in Italy or Germany where people are just on total, or Spain, I'm hearing that they're on total lockdown and that even the police are enforcing it. That is not happening here. All of that the governors have the power to do is to request that people stay home or request that certain businesses close. But even now, the special measures law that was passed to enable this state of emergency says that the governors have to consult with the central government before they even make a request to businesses to close. So that's where this debate that you talked about, Wendy, is happening, where the Tokyo governor is saying, we really need to ask a number of categories of businesses to close, including, as you say, barbershops and beauty salons, because those are enclosed spaces where people be in close contact. People tend to talk while they're getting their hair cut, but also Japanese pubs, izakayas, karaoke bars, live music halls, potentially even restaurants. And the central government is saying, let's hold on. Let's see if we can rely upon the people as individuals collectively to restrain themselves for 2 weeks. And then we'll see where we are. And then we'll decide whether to ask these businesses to close. And of course, we've seen that kind of pattern play out in a lot of places. I mean, I think if you look at what happened in Italy, politicians were saying just before things exploded, I think somebody even went on TV in Italy with a glass of wine and said, let's carry on, people, let's keep going out. So when I see what my colleagues have written around the world, it feels, it's a little nerve-wracking, because it feels a little bit like we're living, we're in the past and you're in the future looking back at us, even though we went into this first. So it's very hard to know exactly what will happen. None of us have the true crystal ball. I think Japan's government is really hoping that they can somehow evade the crisis that has happened in places like Italy and New York. And as I said at the beginning, the one thing that they're not doing that other countries that managed to accomplish that are doing is test widely. And that is a question that I just don't understand why not. Initially, Japan said, the reason why we don't want to test a lot is because we want to spare our hospitals. We want to conserve our hospital resources for the most seriously ill. And under Japanese regulations, for some reason, they had decided that anyone who tested positive must immediately be hospitalized. We saw that even early on with the Diamond Princess cruise ship that was docked off of Yokohama and that was quarantined. Anyone who tested positive was immediately taken to the hospital. And I talked to a lot of passengers, ranging from people who were clearly very sick to, a young 28-year-old woman who said, I barely have any symptoms, but they're giving me, world-class medical treatment. They're all suiting up in hazmat suits to deliver me dinner every day, but I'm not even coughing. So I think for some reason they couldn't kind of get off this mentality that they needed to hospitalize everyone. And it was only a week and a half ago that they changed the rule and said, okay, we're going to make accommodations in hotels and various other public facilities where people who are mildly asymptomatic or mildly sick can recuperate there or at home, and we will conserve hospital resources for the most seriously ill. But they still haven't really ramped up testing all that much. So they removed the one barrier that they said was the reason why they weren't testing widely, but they've ramped up a little bit, but not nearly as much as other places. And I'm just curious. I can't quite understand, and I haven't been able to get a good answer on why not.
Let's turn to the economy for a minute. Right when the emergency measures were announced, the Japanese cabinet also announced a big economic emergency package, almost valued at $1 trillion, with a lot of money going out. This comes on the heels of a Japanese recession. The Japanese economy was contracting as a result of just a slowing Chinese economy and the US-China trade war. So it was having economic difficulties in any event. Then the Olympics were postponed, which also is going to result in a loss of revenues right now with a lot of expenditures. Can the Japanese government really afford this big economic recovery package? And what impact is that going to have on Japan's ability to really participate in the global recovery and the regional recovery?
I think that's a really excellent question. And I think all the factors that you described that were present prior to this pandemic are probably very much in the back of the minds of policymakers as they're trying to thread that needle. They're really, really panicked about that, and they want to avoid further deterioration. Another contributing factor to the contraction of the Japanese economy before the COVID-19 was a consumption tax. So they raised a consumption tax in the fall from 8% to 10% on virtually all purchases, and that really had an effect on domestic spending. So I think there is some sense, I think, that they could perhaps fund some of this by, retracting that. There's a portion of the package that has to do with delaying Social Security payments and what have you. And as any of you out there, and Wendy and Danny, you know this very well about Japan, is that they tend to be much more comfortable with taking on national debt. And they also tend to be much more comfortable with using both monetary policy, but also stimulus spending, frankly. That there are a lot of places in Japan for years that have been sustained largely on government spending rather than, natural market forces. These depopulated areas around the country that have beautiful roads and bridges that are hardly used at all, but they are construction projects that provide employment. So there is kind of a tradition in Japan of using fiscal spending to support a struggling economy. That being said, there's a lot of confusion about the package and what exactly they're going to use the money for. The debate that you referenced earlier between the governor of Tokyo in particular and the central government, but almost all the governors that are affected by this state of emergency, which, by the way, has only been imposed in 7 prefectures that represent the largest population centers. But some of those governors have said, we are reluctant to ask businesses to close because we know that they will be devastated by closing and we don't have any mechanism to compensate them. And in that package, which represents about 20% of Japanese GDP, they said that there were some measures to compensate those businesses, but kind of the hoops that people need to jump through in order to be eligible for that money, they have to prove that their income has declined by 50% year over year, over a month's period. So I think a lot of these businesses are like, we won't survive before we get the payment, which, is something like $6,000. Will that actually help them weather this? I think there's a lot of confusion about what that money is going to be used for. Yesterday, I saw that some of the money has been earmarked to help Japanese companies that currently do manufacturing in China to move that manufacturing capacity elsewhere. So I just think at the moment, it's really hard to tell. There's a lot of confusion about what the money is even going to be used for. I do hear a lot of people talking about this so-called V-shaped recovery, like they're already looking ahead. If we get through this pandemic period, we know that there's going to be a steep decline, but can we come out of it very quickly? And will this package sort of be part of that acceleration after the pandemic has passed?
I noted that one of the objectives of this emergency package is to promote the use of remote work, working electronically and teleworking. And I thought maybe you could just comment on that. Are companies really equipped in Japan to telework? As someone who is personally interested in the promotion of women in the workforce, I think that teleworking could really achieve a lot of the goals of Abe's Womenomics program. And so I guess a question for you is, are companies really teleworking? Are companies really equipped to do that? And could this be a silver lining for Japan if indeed, when they get through this, might this kind of stick with Japan more and maybe invite more women that are making the workplace more hospitable for women who need, frankly, more flexible hours and more flexibility to be home and to work when they can, working around their children's schedules and frankly, their elderly parents' schedules.
So that is the hope, and you would think that this was kind of a natural segue into teleworking. And in fact, Japan was somewhat preparing for that with the Olympics, that the government had already asked large companies to prepare for the Olympics by planning ahead to consider asking their employees to telework during the Olympics to reduce the pressure on the public transit system when we were going to have, something like 750,000 visitors for coming in as spectators. The idea was that we could overload the train system. So if people were working from home, at least the commuters would not be competing with the fans. So there were some large companies, like, for example, I talked a lot to Hitachi, which is, a very old electronics company here in Japan. They, the minute that the schools closed, said that anyone who was a parent, and that was like 10,000 workers, automatically was allowed to work from home. And then I think about 2 weeks ago, they said everyone who was an office worker, obviously the factory floor is a little bit different, but anyone who was an office worker could work from home. So there are some companies that are like that. But as you probably know, Japan, the backbone of the Japanese economy are these small and medium-sized businesses, and they are run on this incredibly old-fashioned set of principles and just logistical things. So not everyone has a laptop that they can take home. Faxing is such an important part of Japanese culture. People don't sign documents, they use a stamp. And if the stamp that is needed, that is the official office stamp, it's not a stamp that's assigned to an individual. If it's an office stamp, there's one of them, then all of the people who have to use that stamp need to be in the place where the stamp is. They can't be separate. We even had that in our own office, that the particular bank that we use for the Tokyo Bureau Bank is not really well set up for online banking. And so our bureau manager was trying to figure out how she could work from home because of this problem. Just yesterday, we got a notice from the prosecutor's office saying, if you want a particular document, you need to come up and pick up the paper form. Like, why couldn't they email that? So there's just so much that's cultural that makes it really hard for people to work from home. And then I thought it was really interesting that just last night, so this is 2 days after a state of emergency has been declared, and when the Prime Minister has asked everyone in the country to telework if they can, the governor of Tokyo did her nightly press conference, and she said, I know there are a lot of people who feel that if they asked to telework, they will be considered truants, or as if they're playing hooky. That to me is just so surprising that she needs to say that 2 days after the declaration of a state of emergency. She feels the need to say that in her public broadcast. And when, like I said, when I was walking outside, we went out around 5:30. I took a walk with my son, actually, and he pointed up at a window that was clearly like a small office. And he said, that looks like the 3 C's. There were 4 people sitting in a very small office, not wearing masks, sitting very close together, and two of them were turned toward each other, talking to each other. And then we walked toward a train station, which is in like a main business district, Toranomon, in central Tokyo. And by no means was it as crowded as it normally is, but there were, streams of people walking to get on the train and clearly coming out of office buildings in their suits and carrying their briefcases. My friends are sending me pictures, or my colleagues are taking pictures of what's going on in places like New York and San Francisco, and, Fifth Avenue is empty. So I think culturally, it's been a real wake-up call here, but a shock at how difficult it is to it is not a seamless transition to teleworking. To your point about gender, the other interesting thing is I've interviewed some men who said, it's very difficult for me to work at home because my wife and children are there. And I'm like, well, yes, that's true around the world, that there are plenty of people working from home with their partners and their children at home. I mean, I think in fairness, a lot of people live in very small quarters in Tokyo. They're not lucky enough to have separate bedrooms, studies where they can go hide themselves. But I think it will be interesting to see whether there is a transformation on gender. I mean, I was very heartened when I talked the other day to a man from Hitachi, that on the one hand, the sad side of the story is that his wife's employer was not letting her telework. The flip side is he was home alone with their 3 sons, and he was having to do a lot of the childcare. And so he was kind of probably learning, he was having, an experience of learning what his wife does most of the time. He was working 2 shifts.
Well, thanks. Let's hope that's one of the enduring benefits or shining lights from this, because in a lot of ways, I think this could really help women in the workplace in Japan. Over to you, Danny. You want to pick it up?
Motoko, those are really, really fascinating sort of cultural insights and aspects. It's quite a mixed picture, and I guess we need to keep our fingers crossed that this can be a catalyst for some of the positive transitions in terms of Japan's culture. I think I saw the Ministry of Health issued a report within the last couple of days that suggested that the teleworking was somewhere in the neighborhood of only 5%. But that
I think it's up a little bit. I think it's up to about 12%.
Really? Okay. Well, that was the emergency decree. Well, I wonder if we could shift gears a little bit and talk about the politics of COVID in Japan. So Shinzo Abe had a plan. He had a plan for securing his legacy. You host a successful 2020 Olympics. You goose the economy through Abenomics. You step down at the end of your 3rd term. You hand things over to your carefully curated, handpicked successor. But then came the virus. So the Olympics have been postponed. The economy is not just in recession, but is being battered with really hard times ahead, given the global outlook. You and Wendy mentioned the battle he's having with Governor Koike, who's not just a local official, not just the governor of Tokyo. She's a potential political enemy to the Abe legacy. But he's fighting with other local officials. His approval ratings have slipped. He's been, I guess for a politician even worse, he's been ridiculed for his face mask distribution plan. He's been criticized for being complacent. So I know this is a crystal ball kind of question, but when you look at the political landscape, what are the scenarios that seem likely? If COVID gets out of hand, if he manages to muddle through or to do well, what does your reporter instinct tell you some of the likely scenarios might be for Japan politically going forward?
Well, I think that was a perfect setup for why perhaps Abe acted so late. And, I think you've previously pointed out that he is by no means alone in that in political leadership around the world. There have been a lot of examples of people delaying action. But it was very curious early on that Japan, like you said, had their first case in mid-January. They had a lot of people that they repatriated, the government repatriated from Wuhan. So there was that first kind of burst of worry that there might be imported cases. And then Japan had the Diamond Princess. So very early on, Japan had to deal with this crisis on its shores. And the government pretty roundly was criticized for its handling of that. You know, history will decide in the long term whether the sort of really harsh criticism was warranted, but there's no question that the government was politically hammered for its handling of the Diamond Princess quarantine. There was even, you know, a Japanese epidemiologist put out YouTube videos in both Japanese and English expressing his alarm at how the health ministry was handling it. There was sort of this notion that the bureaucracy was bungling it, that Abe was sort of absent. There were a lot of media and social media pictures of him out to dinner and kind of just checked out on the crisis early on. And I think all of the issues that you point out are why, right? That he, in his mind, he was thinking about preserving the Olympics. That was that's like supposed to be the capstone of his political career. He is already the longest standing prime minister in Japanese history. And so he wanted to kind of go out with this wonderful bang. And so I think a lot of his energy was pointed toward preserving that. And I think a lot of people were alarmed and thought that perhaps he was too focused on that rather than the kind of emerging public health crisis. You know, internationally, at first there were calls to cancel or delay the Olympics. And then domestically, by the time the decision was made, polls show that about 70% of the Japanese public just thought it was not possible to hold the Olympics. So I think that was something that occupied a lot of his attention and energy. And now that we have this, you know, that's out of the way. And so now what he has to do is focus on handling this COVID crisis. And like you said, there isn't a crystal ball. I think if Japan spins out of control and goes the direction of Italy or New York, it's going to be hard for him to recover from that. Like any leader, the blame will be laid at the government's doorstep in many ways. If for some reason they dodge the bullet, you know, it will be difficult to see whether he will get the credit for it, or as you point out, you know, the Tokyo governor, in some ways, she sort of resembles, say, for example, Andrew Cuomo, right? That she is taking on this leadership role. She's been very quiet for 2 years because when she was first elected, she clearly was enjoying the sort of first woman governor of Tokyo. She took a very public, you know, she was on TV almost every day. She went to Rio with the prime minister when the handoff between the Olympics there to Japan. She was there on the stage. So she was a very public figure at the very beginning of her administration. Then she showed some national aspirations, formed a national party, and tried to, you know, had her party standing in national elections, and they were kind of hammered. And so her reputation was damaged by that, and she sort of disappeared. She wasn't around very much. She wasn't appearing in public very much. She didn't seem to be taking much of a leadership role. But then with this COVID crisis, she's been very, very present. Like I said, she's doing these nightly press conferences. And so to that extent, it may well be that the prime minister now sees her again as a political rival, and that the arguments with her about the appropriate steps to take with regard to the businesses is as much a political fight as it is a policy fight about what the right measures to take in this time at this moment are. And, you know, as people are saying, as even the leader of WHO has said, it's a dangerous time to be playing politics, right? Like, if things go wrong, they will go terribly wrong. If they go right, it'll be interesting to see. I mean, even in the absence of this crisis, there was a question about who was going to succeed him. He's already extended his term to much longer then they had to have a special vote to allow him to stand as leader of the party. And so the question is whether after the Olympics he would want to remain as prime minister. I think there's no question that he wants to be the prime minister of Japan when the Olympics, which are still being called Tokyo 2020, are staged in 2021. Abe still wants to be the prime minister. But then after that, the question is who's his likely successor, and that has been a question even prior to this crisis. Like who is ready, prepared, popular enough, and has the support within the party to succeed him.
Well, shifting focus a little bit, Motoko, one of the questions that we're getting has to do with the impact of coronavirus on Japan's relationship with its neighbors, with other countries. So, Abe hosted the G7 2 years ago. He chaired the G20 last year. I think, frankly, right about now, Xi Jinping was supposed to be knocking back sake under the cherry blossoms in Tokyo.
That's right.
Relations with South Korea have gone from bad.
Were terrible before this.
The U.S. Embassy just last week, as you know too well, warned Americans to, get the heck out of Japan. And Japan has returned the favor by imposing a ban on travelers from the U.S. and Canada and quite a few other countries. So some of the viewers are curious about how international factors might be calculated in Abe's thinking. For example, was he worried about the accusation of resurgence of Japanese militarism if he declared an emergency, sort of martial law-like? But more broadly, should we expect changes in Japan's international relationships and its international presence in the aftermath of the coronavirus experience?
That's an excellent question. I think as before the coronavirus crisis, China is always going to be the elephant in the room. And before this, Japan had been taking some steps to warm relations with China, I think partly as a hedge against what appeared to be a withdrawal of leadership and presence in Asia by the United States. And so there was this concern of, not wanting rising China to just dominate the region. Japan, thought it was in its practical interest to warm relations so that it could kind of influence or be a seat at the table in whatever China was trying to do. And so that visit by Xi Jinping was all part of that calculus. I think things are very confused now because of the kind of questions about supply chain and tourism, that Japan was very reliant economically on China and now is sort of looking at a future in which they don't know whether they will be able to rely, but not knowing who would replace that. So this sort of effort to repatriate or move manufacturing capacity out of China to somewhere else, presumably Southeast Asia would be the most likely place. That is not just an economic decision or a logistics decision, it's obviously also a political decision. I think the other question for Abe is that when it appeared that the U.S. was not taking so much leadership in the Trump era in Asia, Prime Minister Abe was trying to kind of be the leader. He held together the TPP-11. Like you said, he hosted G20 in Osaka just last summer. But in this COVID crisis, he has not really played what anyone could argue as a world leadership role. I don't know if anyone has been able to do that. The sort of, in some ways, the sad thing about this crisis is it's caused everybody to turn inward, right? Like border closings are happening all over the place. There are a lot of questions even in Europe. Early on, there were questions about whether Germany was, stopping exports of important medical equipment. So it's not clear to me that anybody has sort of emerged as the global leader of how to manage this crisis. in as much as he was attempting to play the world statesman, the new world statesman, the adult in the room, it's not clear that this crisis is giving, or that he's taking the opportunity of this crisis to take that platform. One could argue that he's doing the opposite, that by not being present early on, that he kind of lost that opportunity. To your point about whether he's concerned about rising militarism or perceptions about that, it is interesting how much he's talked about things like human rights and rule of law and what is capable. Many times during his speech about declaring the state of emergency, he kept saying, "This is not a lockdown. We are not doing what you're seeing in other countries. I just want to reassure you, we cannot order you to do this or that." And even when they repatriated Japanese citizens from Wuhan, what they asked of everybody is, when you get off that charter flight that we have brought you back on, we want to test you, give you a PCR test. And most everybody said yes, but there were a couple of people off the very first flight that said no and said, "We want to go home." And there was a little bit of a public outcry about this, like, wait a minute, you just let those people go home and no restrictions? They're not you didn't even give them a test, so we don't even know if they have it. And so now they're just allowed to go home and go grocery shopping and go to clubs and whatever, and the gym, and maybe they're going to spread it. And he came out very quickly and he said, it's a matter of human rights. So it's very interesting how often he's used that rhetoric in describing why the government is not doing something here in Japan with regard to responding to the public health crisis. And I'm not quite sure what to make of that, because this is also the prime minister who's very much wanted to revise the Constitution and revise Article 9. And he sort of changed his rhetoric and softened it over the years that he has been prime minister, but it still remained a goal of his. So it is curious that during this crisis, how often he's referred to human rights and not wanting to violate human rights in terms of restricting people's movement or forcing them to take tests or forcing them to quarantine and what have you.
Perhaps I can just shift the conversation back to some of these more demographic social issues. We have a question in from a Mr. McLean on YouTube, and he was wondering, and I think this builds on the question that we talked about, whether the virus and the aftermath may help women in the long term. He wondered if that will also maybe affect Japan's view towards foreign workers, particularly in the medical sector. We have seen Japan slowly open up to allowing nurses in particular from Southeast Asia. My understanding, there is a shortage of nurses in Japan. And, what are your views there? Do you think this will change the attitude in the medium and longer term?
It's a great question. I mean, I think in the short to medium term, they're going to have a little bit of a labor crisis. They already had a labor shortage. And 2 years ago, Parliament passed a law to allow for a new category of visas where they were going to open up to foreign workers something like 350,000 visas, which is kind of a drop in the bucket when you consider this is a population of 127 million people. But it was more open than Japan had previously been. Japan has been very wary about immigration policy. And even when they passed this, they said it's not an immigration policy. These are foreign workers, and they will only be allowed to stay for 5 years, and they won't be allowed to bring their families. But they were targeting particular industries that were crying out and saying, we need help. We don't have enough workers. And among them were care workers for nursing homes, because Japan is also the oldest country in the world in terms of its proportion. Nearly a third of the population is over 65, or I think it's nearly a third of the population is over 65. And so they have a lot of people that are going to continue to need more and more care, both healthcare, but also just sort of day-to-day help with household needs, whether they're in an institutional setting or at home, and there just aren't enough people to do those jobs. And so in the short to medium term, with the borders closed, it's going to be impossible to bring workers in to do those jobs. And so there could very well be a pretty near-term crisis in terms of caring for old people, whether or not they have COVID or not, just for daily needs. As they age, they're going to have more and more needs for care, and there just aren't enough people to do those jobs. So, but to your question of whether Japan will then ultimately become more open to foreign workers, I think some people really in the passage of that law and in the debate about it and in support of it said that it's absolutely necessary. But the fact that it was done in such a limited way, that it was only 350,000, that they could only stay for 5 years, had people questioning how effective it would be. And before, again, COVID, what was so interesting was that the foreign ministry had said that applications for those visas were far below what they were expecting. So the people who they were hoping to invite to come to the country were kind of looking at the terms of those visas and the opportunities and saying, maybe not. So I think if hopefully we will come out of this crisis soon and that it will not have done a huge amount of damage. But after that, Japan will have a reckoning with how is it going to deal with its aging population and the fact that it doesn't have enough workers to cover a lot of its needs going forward.
And just a related question from the audience on the demographics. There's a question on, there's so many senior citizens in Japan, in the world, particularly in the US. I mean, anyone over 65 is basically told, don't leave home, you're in a high risk category. How do you square the circle with Japan of having such a senior population, but yet having so few deaths? Is there any discussion of how that's happening?
That is the biggest puzzle of all. I mean, so one of the things that Japan did very early was close the schools. When Japan closed the schools, it was abrupt, and the prime minister kind of made the decision unilaterally, which was surprising. He did it without even truly consulting with the education minister, much less, teachers unions or principals around the country. So it sort of came as a shock. And a lot of people said at the time that, the epidemiological data coming out of China showed that children were the least affected. So why are we closing the schools? We should really be addressing the aging population. And there hasn't really been any policy that's been targeted at the aging population specifically here at all. And it is so curious to me. I have the same question, and I've been asking lots of people, and we just don't know. I mean, there is some possibility, again, that a lot of COVID deaths are occurring that are just not being categorized as COVID deaths, that people may be dying of pneumonia, and they're just being categorized as pneumonia or some kind of, general respiratory disease. The Prime Minister was asked in a press conference about this point, and he said that anyone who dies of unidentified pneumonia will receive a COVID test. And the very first death in Japan was, very sad actually, because, well, they're all very sad, but this was a taxi driver had been infected, presumably by driving tourists around, and had gone to a party and spread the virus to a lot of his colleagues at, was like a work party, a New Year's party. None of them got seriously ill, but his mother-in-law did die, and she was the first death in Japan. And so I had thought after that first death that people would really take it seriously, that even if you yourself could not be seriously ill, you could get an older family member or colleague or community contact sick, and that they would be very serious. And it just didn't go that direction. But she was, her COVID status was confirmed after her death. So there have been a lot of hard questions that we haven't been able to get good answers on. The health ministry doesn't release data on deaths from pneumonia until 5 months later. So we just don't have data for 2020 yet. And so it's very, very frustrating because we really want to know the answers to those questions.
I think with that, we're going to bring the program to a close. Let me just thank you on behalf of the Asia Society Policy Institute, Motoko. You've really given us just great insight to what's going on. You've been able to answer questions, and I think you've validated some of the open questions people have about how this is going to play out in Japan and in Tokyo specifically. We're just grateful for you joining us, and we hope we can invite you back sometime to kind of update us on.
I would be honored to come back, and I hope it'll be a good, positive update.
Yeah. Well, thanks again, and for our viewers, thanks for joining us, and we hope that you'll continue to join us for future programs, including the relationship to COVID to other regions in Asia and around the world. Thanks again. Good night, everyone, and good morning in Japan. Bye.
That's right. Thank you. Thank you, everybody. Thank you, Jenny. I really appreciate it. Thank you, Wendy. Bye-bye.
Thank you.
Thank you.